Hi. So, uh, today was leg day, kind of. So, uh, a little bit of upper body too. I've been meaning to build up my shoulders a little bit. So, um, did some work early on with the landmine attachment on the barbell, doing the squat using a Viking press shoulder attachment, right? So side loaded plates, uh, harness, handles, makes it real comfortable to do that kind of squat versus having to really work on overloading the back extension and everything like in a goblet squat. So sometimes you hear a coach or somebody talk to you about exercises that you should do, and sometimes in your particular situation, it's maybe not the best exercise selection for your particular situation. So we have to be mindful about the selection of exercises that we're not aggravating the joint and we're stimulating muscle development and growth and endurance and strength and increasing stabilization and vascularization and the circulation, all of this, right? So we're losing fat, we're lymphedema, all these kinds of things are just like go buy diabetes, go buy heart disease, buy, right? Everything is better. Your triglycerides are better. Your carbohydrates are better. Although I'm gonna make you probably eat more carbohydrates than you thought that you would ever eat on a diet. Okay, you need your carbohydrates. If you do not have carbohydrates, then you cannot exercise, right? And exercising is what's gonna help up your metabolism, increase muscle, increase the metabolic rate. The resting metabolic rate increases as your muscle mass increases, right? But there's a big difference between being overweight with fat and having that weight and pressure on your spine and actually having tight, hard muscle around the spine, which doesn't allow the joints to compress as much as they typically would if all of those muscles were lax and weak. And so every little step would just bump, bump, bump. So strengthen as much as you can, as slow as you need to, so that you can build stability and endurance and recover whatever lives we have left to live. So, um, slow progress. It's okay. Weight loss, slow progress. You want to make a little bit of a dive when you hit a plateau, like do that. It's okay. Short, man. Right? And then once you start going again, just freeze up and ride that out. Right? There's no need to just like try and just cut all of your calories and try to ramp up all of your exercise. You're setting yourself up for a horrible failure and a rebound after your cycle, your diet, or your challenge is over with. Don't fall into this cyclical thing where you get lean and then you get fat and then you get lean and you get fat and you get lean and you get fat. Get lean, stay reasonably lean. Use that as a gauge to know, like, okay, I'm starting to get a little bit too budgy. I'm gonna cut back on my calories a little bit. I can start to feel the weight on my joints. We don't want to even get to that point, right? Like, pay attention to your body. Um, if we're getting too lean, then add the calories. You're gonna feel fatigued. You're gonna have, all right. So you maybe need a deload. Take a little rest day. Have some extra calories. It doesn't need to be junk calories. It could definitely be, just more of the same that you're already eating. If it's lean, eat lean. Just have an extra serving or something. It's more protein. It's a little extra carbs. Still stay low with the fat. Um, the carbohydrates will get you out of that brain fog, and get you functioning again and like a normal person. And then but you have to do the work. You have to burn those calories and get your blood pumping a little bit and build muscle and breathe heavy and not even necessarily sweat. I mean, that's a for sure sign of adding intensity to your regime, but uh, that doesn't necessarily have to come right away. Some of these little tiny movements that we do in the gym is very difficult, depending on your level of stability in a number of different joints, right? But it starts with the foundation. Add your feet, your arches, how we control our toes, our ankles, and knees, hips, right? Lumbar and thoracic spine, cervical spine, shoulder girdle, right? All of this shoulder complex, pectoral girdle. I believe that's how it is. I can't remember at the moment, but so all of these things move together. Everything is connected. Fascia is connective tissue. It connects everything to everything. So if you're having a pain in your neck and it's connected to your toe, you can bet your ass it's connected. Okay? It may not be directly, but indirectly through a chain of motion and events, that pain is connected to that pain. Okay? So we have to sometimes break it down and rebuild everything from the ground up, and it feels really frustrating sometimes, but it's safe. And the longer we can train safely without injury, the better and further along in the rehab process we can get. Like I said before, bodybuilding is a natural progression of rehab, of just normal physical development, right? I may not be able to do really intense athletic sports like I used to, football, wrestling, MMA, martial arts, boxing, right? We may not be able to do that anymore. But I can still develop a healthy body without putting myself through unnecessary trauma, and actually that little bit of work that we do can increase over time and result in an increase or decrease pain, an increase in pain tolerance, an increase in your pain threshold, but a decrease in overall pain because there's more stability, more strength, more endurance, more tissue to protect the joint. So that protects against all that compression, nerve impingement, arterial occlusions, right? Anything that's gonna send a nerve pain, burning sensation, numbness, tingling, any of those kind of symptoms are symptoms of these things, right? So we gotta address it, right? You gotta get what's tight loosened up. We gotta get what's atrophied stimulated and built back up, increase circulation. All of these things start to lend towards you having more functional movement patterns, but also correcting the very thing that's causing the pain. Maybe not initially from an injury, but definitely this is the thing that is perpetuating the pain that we feel in our bodies. There is something we can do about it. What proportion of time and energy you can spend on that, everybody's a little different. If it's really so severe that we can't function at work, then I beg, I plead with the medical systems to help. on that end with prescriptions and disability and things like that. You know, placards. Sometimes just like I look great, but some days like I can't even walk, you know, to the bathroom without a limp, and like hobbling on my leg because I just can't feel my foot or it's striking pain on the heel, and the hip and the knee, right, all the way up the spine, up to the ribs, and the neck and the shoulder, right, like it's just some days it's bad, so you know. But if you're using those tools, don't take advantage either. Don't be a dick, right? If you don't need it, don't use it. If you need it that day, it's cool. We understand. I feel the same way. Some days I need the help. You know, some days I needed help walking to the car. I needed help, but most days I'm pretty functional. I'm doing okay, and those days that are hard are increasing though. All right, so um, stay healthy, stay fit, stay functional, stay strong as long as you can. But like I said, it doesn't necessarily mean high intensity interval training. It doesn't necessarily mean jumping around. It doesn't necessarily mean running or shit ton of cardio. It doesn't need to necessitate that. When you when you partner and pair your appropriate nutrition for you, your metabolism, your activity levels, your tastes, and you partner that with your activity plan that produces a balanced either maintenance or surplus or deficit in your total intake so that you can achieve the goals that you want. Everything is systematic. We have estimates. Every nutrition coach, everybody has the same formulas to kind of work on. I have a little bit more experience with certain individuals that skews that numbers a little bit. Uh, so you know, it's different, right? It's different. So the active, normal young person at 20 years old, 30 years old is not going to be the same, you know, metabolic rate and activity level as, you know, 40, 50, 60-year old, previously an injured individual who has movement pattern compensations and has a hard time moving around. Your metabolism is not going to be the same. Your metabolism at 10, 20, 30, or 10, right? 20s and 30s, you're going to be, you know, body weight times 10, 12, 15, maybe even. Depends on how athletic you are for your calorie intake. But man, I'll tell you, some of my clients I've seen just not making any changes, just measuring their consistent metabolic rate from day to day, cross with what their nutrition is and actually getting the numbers down, weights twice a day, calorie intake, all that. Um, you know, some of these people are like body weight times 6 or less. Okay, so um, we got to get moving to get that metabolism running, and then we got to meet it with the nutrition, and then find where that nice balance is for your lifestyle and your needs. So if you need coaching, it's great. We've got all levels of coaching from totally online to all you want in-person sessions. So reach out, get the help you need. Let's get it.